This is Mountain Health Today. I'm Ted Owens, your host. This program is brought to you by the Tahoe Forest Health System. And today we'll be talking with Mr. Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, it's a pleasure to have you with us today.
It's great to spend time with you here.
Harry, some time back we have in the past talked about the Cancer Center, that'd be the Gene Upshaw Memorial Tahoe Forest Cancer Center. Share with us a little bit about the program and what it is.
You bet. Our cancer program here at Tahoe Forest Health System has been around for a total of approximately 15 years. It's really a high quality, state-of-the-art, comprehensive cancer center that really offers equipment and technology that's equal or on a level of very large urban healthcare settings. And so we're just really pleased about that. I still recall when I first visited Tahoe Forest and walked through the center, I thought, wow, this is probably one of the most special and complete and comprehensive centers I've ever seen. And so it includes features our Varian True Beam radiation therapy device, the latest technology there, and just offers a full array of services.
Harry, what kind of service? Let's do a little quick menu rundown about the services that are provided.
Sure, just a partial list. We have several medical oncologists and radiation therapy physician specialists, but we offer medical evaluation of any cancer patient, diagnosis and treatment of those various kinds of cancer. We have PET CT equipment, which is rare to have, and that also offers CT scanning. We can do PET scanning to see cancer hotspots, and we also use the device to precisely position where the treatments would occur with our Varian True Beam radiation therapy machine. We offer ultrasound, digital mammography, chemotherapy, infusion services, other infusion services as well. We have on-site pharmacy and lab services, comprehensive physical therapy, a variety of family support programs, and psychosocial programs.
Now, Harry, the Gene Upshaw Memorial Tahoe Forest Cancer Center has, I believe, from very early on, had a very important affiliation with UC Davis. What is that affiliation and why is it important to a patient?
We're thrilled to be a part of the UC Davis Cancer Care Network. And we were one of the earliest rural hospitals to be participating in that. And so this unique partnership with a great academic medical center that also really connects us to a variety of Northern and Central California teams, it really allows our team to offer the very first-rate leading edge cancer care right here close to home. And this is a hospital-based community cancer center type program, as we're affiliated with the UC Davis Cancer Care Network. And it's the reason that we were able to obtain that great accreditation or approval by UC Davis is based on a very strong evaluation that they did of our program, and they're excited to lead out and assist us in this rural area.
Harry, the synergy of that affiliation and academic health system affiliation is of great benefit. What are some of the things that make treatment different because of it?
What it does do is it allows many physicians in many different settings to come together and review our specific cancer cases and talk about what is the best science to deal with that particular kinds of cancer. So it's a great setting that we have, not only with UC Davis, but with other sites as well. And in addition, this partnership with UC Davis allows us to have the very best opportunities in cancer clinical trials as well through their extensive network.
Harry, we'll come back to the trials in a second, but what I understand happens every day at lunch is the oncologists are actually reviewing cases with other oncologists through this network. Share with us a little bit about how that works.
That's correct. Each workday of the week, our cancer center is discussing with cancer physician specialists in other communities and with UC Davis a particular kind of cancer. So, for example, one day might be breast, another day might be urological cancer, another might be lung, another might be another anatomy area, etc. And they're talking about specific cases and the best way to treat those. And this is really rare to have those kinds of therapeutic discussions going on each day of the work week.
So that's actually a built-in second opinion on cases. Actually, it's more than just two. You touched on cancer trials a moment ago. What are cancer trials, and why are they important?
The clinical trials really allow us to participate in the best new drugs or therapies that are out there, and more than 11% of our patients are able to participate in those. And it's really great to actually know from a personal patient testimony perspective out there in our community that our clinical trials have actually saved lives. That's really special.
You're watching Mountain Health Today. I'm Ted Owens, your host. We're going to take a break and we'll be right back. Thank you for tuning in. And welcome back. I'm Ted Owens. This is Mountain Health Today, and we're talking with Harry Weiss, President and CEO of the Tahoe Forest Health System, and our subject is the Gene Upshaw Memorial Tahoe Forest Cancer Center. Harry, when we left, we were talking a little bit about the affiliation with UC Davis and clinical trials and the benefit thereof, but let's go back to a little bit of the state-of-the-art equipment and services that are provided in the center.
Sure. As a part of the Gene Upshaw Memorial Tahoe Forest Cancer Center, we're able to participate in what's called a rural oncology network, which again, what's really important for our patients to understand is it really allows for state-of-the-art healthcare right here in this amazing rural community, right close to home. And this happens via several important assets. We're able to use telemedicine technology, and so we're able to provide patients in remote areas access to nearby cancer services. We've been doing this for a long time, even before the pandemic, where they can do virtual visits with our physicians, and we're in turn connected with the UC Davis Comparative Cancer Center in Sacramento. And it allows our patients just to get the same care they would experience if they'd traveled physically to our cancer center. And so we're just really pleased for that. And I think the other part that's unique and special about our cancer center, and this is a differential item that doesn't necessarily exist, is that we really believe in treating the whole person as they're dealing with cancer. And all of our support programs are designed to help our patients, and these support programs are really some of the best in the country.
Harry, I know that what you were just talking about is kind of a cultural thing with the Cancer Center, in that you have patients, I understand, that come from far away very often to the center, but are able to return home and still have your team oversee their treatment unless it's necessary to be present at the center. Is that true?
That is correct. They only need to be at our cancer center for just the right amount of time for their meetings with their physician or their infusion therapy or the radiation therapy. And if they are some distance away, then our team will kindly connect with them when applicable via telemedicine. And we've been doing this for years. And again, with our supportive care services and our nurse navigation, this really keeps our patient comfortable. They understand right where things are.
I think this is an important element to share with folks at home, which you just touched on, the nurse navigation service. Now, many folks probably at home don't have any idea what that means and why it's important to their journey if they've gotten a cancer diagnosis. So what does the navigation program do for the patient?
If there was ever a patient category that could really use the comfort and care of a nurse navigator, would certainly be cancer patients. And we have a great team of nurse navigators at our Gene Upshaw Memorial Tahoe Forest Cancer Center program that are really strong advocates for our patients, that really help our patients move easily through a complex process. So they're really focused just on one thing, and our nurse navigators are focused on everything. And that means we want the patient just to focus on healing and getting well. So our nurse navigators really are responsible for facilitating the timely and appropriate care, no matter what and where that is, support for that patient, their families, before, during, and after the treatment.
And Harry, a cancer diagnosis is a very emotional thing for patients and very stressful. So is a nurse navigation program common in other cancer programs in other organizations, or is it fairly unique to your program?
Some have it, but I think many don't, because this is a free service to our patients, and they offer, more than probably 5 different categories of help for our patients. They offer specific education to understand that diagnosis, terminology. Number 2, they assist with appointments. Number 3, they manage referrals. Number 4, they really introduce that patient to all of our team members. Number 5, they really answer questions about the entire treatment process and even assist with transportation, finances, insurance, what are their fears, their anxiety, family support needs, and they're going to be that patient's advocate.
I think that's incredibly important. Healthcare is a complex system, no matter where you go, and very complicated. So it can be rather intimidating, I think, to patients trying to navigate and maneuver through the program. So you said that the nurse navigators advocate for the patient. What does that mean?
By advocating, they're really owning all aspects of where that patient is and what their future needs to look like holistically again, and what their family needs are. And so this is a tremendous time commitment of really assisting that patient where they're focused on one thing, and that is getting well.
And before we take a break, Harry, there is no charge for this nurse navigation program, correct?
You're absolutely correct. This is a free service for every patient.
Very nice. You're watching Mountain Health Today. I'm Ted Owens, your host. We're going to take a break and we'll be right back. Thank you for tuning in. Welcome back to Mountain Health Today. I'm Ted Owens, and we're having a conversation with Harry Weiss, President and CEO of the Tahoe Forest Health System, and we are talking about cancer care. Harry, a few moments ago you shared in great detail the nurse navigation program. and all that it does for patients on their journey to care. But beyond that, there is another menu of services that are also available to your patients in the Gene Upshaw Memorial Tahoe Forest Cancer Center. What are those services and programs?
Yes, we're really happy to share that beyond even the Navigator program, that we have a cancer support series of very excellent programs that aren't found in many centers. And these cancer center or support programs really focus on the quality of life of the patient, their entire family, and even the caregiver. And this is a very in-depth connection with our patients and their families that really, based on thoughtful, professional, engaging conversations, we're really trying to help the patient and their family with any social related issues, psychological issues, emotional, maybe functional needs that might be a problem because of illness for the patient, the family, their home, etc. And this is so valued, so appreciated because this is an extremely, or it could be a very stressful time for the patient and families.
Certainly, and I understand that in addition to those programs, you even have things that you would not expect to see, like acupuncture, lessons or advisement on how to wear a wig or apply makeup during cancer care. And that's true, right?
That's correct. So we have a service that's available for wig fitting, styling salon, to really come up with something that's custom for that patient so they're feeling comfortable, should their cancer cause hair loss. We have acupuncture, for example, that's available. And what this really does is it's delivered by licensed professionals, and it can really lower the side effects of chemotherapy or radiation therapy. Again, a holistic view program for our patients. We offer biofeedback services where a patient can really learn how to relax. And these are self-regulation skills about how our body functions, just to relax, ease chronic pain, ease stress, etc. We have caregiver education for those that surround the patient. And then we have another important thing that's important for us, whether we're healthy or ill, and that's exercise for energy. And so we have custom exercise programs to stay active in a safe way, which also promotes healing in the journey with cancer. And then we have very general support groups that are led by psychologists, and they really explore how to help a patient and a family really promote health and healing. And then we have home health services. This is really rare that most cancer centers don't have. That includes home nursing care, respite care, palliative care, hospice services, and as you said, the wig and styling salon. We even have breast prosthesis as well.
Harry, that is an incredible list of services that are available. Again, as with the nurse navigation program, is there a charge for these services?
These are all free programs that we've offered to our patients from day one. And I don't know any other cancer center that offers all of these services for free. But that's how much we love and care for our patients.
So one question I think that one would have is, how do you fund those services?
We do actively pursue philanthropic dollars from our community to help us provide these excellent services. And our community has been very responsive in this. And even if there was a little bit of a shortfall, our health system is really committed to making these available to our patients.
Now, the foundation has provided a great deal of funding through the years. It is one of the larger categories that donors contribute to. Is that a fair statement?
That is correct. It's really valued by donors in our community.
And how do you find the people that provide the services? I know you have acupuncture, Chinese methodology, in that the psych services, even things like makeup and wigs. It's not a traditional service found in a healthcare environment.
Our team basically goes out and seeks out skilled individuals in each of these professional skill set areas. And acupuncture, for example, has to even go through our medical staff privileging area. Our psychologists go through medical staff privileging. And so they're carefully selected, based on skill and team acclimation to provide that great holistic care that our patients expect.
And Harry, just in the closing minutes here, where does one go to find out more information about the Gene Upshaw Memorial Cancer Center?
That's a great question. They can go to TahoeCancerCenter.com for great information on this great service.
Thank you. This is Mountain Health Today. I'm Ted Owens, your host, and we've spent our time today with Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, thank you so much for being with us, and for the folks at home, thank you for tuning in.